Obsessive-compulsive disorder, commonly known as OCD, affects approximately 2 to 3% of the global population, making it one of the most common mental health conditions worldwide. Despite its prevalence, OCD remains widely misunderstood and often misrepresented in popular culture. Today, we delve into the reality of OCD, a complex neurobiological condition that can profoundly impact every aspect of a person's life. What exactly is OCD? At its essence, OCD is characterized by the presence of two key components: obsessions and compulsions. Obsessions are unwanted, intrusive thoughts, images, or urges that repeatedly enter a person's mind, causing significant anxiety or distress. These aren't simply excessive worries about real-life problems, but are intrusions that feel alien and deeply disturbing to the individual experiencing them. Compulsions are repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession. These aren't pleasurable activities, but rigid rituals performed to temporarily reduce the overwhelming anxiety triggered by obsessive thoughts. What distinguishes OCD from ordinary habits is that these compulsions are excessive, time-consuming, and significantly interfere with daily functioning. The cruel cycle of OCD. OCD operates as a vicious cycle. When an intrusive thought occurs, it triggers intense anxiety. The person performs compulsions to neutralize this distress. The temporary relief reinforces the behavior, strengthening the cycle. Over time, compulsions must be performed more frequently or intensely to achieve the same relief, leading to an escalating pattern that can eventually dominate a person's life. What makes OCD particularly tormenting is that most sufferers recognize their thoughts and behaviors as irrational or excessive. However, the overwhelming anxiety makes resistance seem impossible. This insight into the irrationality of their condition often adds layers of shame and frustration. Common manifestations of OCD. OCD can manifest in countless ways, but several common themes emerge. Contamination fears involve persistent worries about germs, diseases, or environmental contaminants, leading to excessive cleaning, hand-washing, or avoidance behaviors. Checking compulsions involve repeatedly verifying that potential dangers have been neutralized, checking locks, appliances, or seeking constant reassurance. Order and symmetry obsessions involve distress when objects aren't arranged just right, often accompanied by magical thinking that something terrible will happen otherwise. Intrusive violent or sexual thoughts are particularly distressing as they directly contradict the person's values and desires. Religious or moral obsessions involve excessive concerns about sin, blasphemy, or moral failings. It's important to understand that the content of obsessions often involves what the person finds most abhorrent. A devoted parent might have intrusive thoughts about harming their beloved child. A deeply religious person might experience blasphemous thoughts. The content typically attacks what the person values most. OCD across the lifespan. OCD can emerge at any age, though onset often occurs during childhood, adolescence, or early adulthood. The presentation may differ across age groups. Children may struggle to articulate their obsessions and may simply appear rigid or anxious. In older adults, OCD symptoms might be mistaken for other conditions like dementia or normal aging. Without appropriate treatment, OCD typically follows a chronic, waxing and waning course. Symptoms often intensify during periods of stress, major life transitions, or hormonal changes. However, spontaneous remission is rare, highlighting the importance of proper treatment. The neurobiology of OCD. Research has revealed that OCD involves dysfunction in specific brain circuits, particularly those connecting the orbitofrontal cortex, anterior cingulate cortex, and basal ganglia. These circuits play crucial roles in error detection, impulse control, and habitual behaviors. Imbalances in the neurotransmitter serotonin also appear to play a significant role, which explains why medications affecting serotonin can help manage symptoms. Genetic factors contribute significantly to OCD risk, with first-degree relatives of those with OCD having a higher likelihood of developing the condition. However, genes aren't destiny. Environmental factors interact with genetic predispositions to determine whether OCD manifests and how severely. The impact of OCD. The impact of OCD extends far beyond its symptoms. The condition can severely disrupt education, with students unable to complete assignments due to perfectionism or checking rituals. Occupational functioning often suffers as compulsions consume time and mental energy. Relationships become strained as family members are drawn into accommodating symptoms or become frustrated by seemingly irrational behaviors. The physical toll can be substantial as well. Excessive hand-washing may lead to skin damage. Lack of sleep due to nighttime rituals causes chronic fatigue. Avoiding certain foods based on contamination fears may lead to nutritional deficiencies. The emotional burden includes high rates of depression, social isolation, and in severe cases, suicidal thoughts. Evidence-based treatment approaches. The gold standard psychological treatment for OCD is cognitive behavioral therapy, CBT, specifically exposure and response prevention, ERP. This approach involves gradually confronting feared situations, exposure, while refraining from performing compulsions, response prevention. Though initially anxiety-provoking, this process helps the brain learn that anxiety will naturally subside even without compulsions. Medication, particularly selective serotonin reuptake inhibitors, SSRIs, represents another effective approach, especially for moderate to severe cases. Often higher doses than those used for depression are needed, and benefits may take 8 to 12 weeks to fully manifest. For many, a combination of ERP and medication offers the best outcomes. For those with treatment-resistant OCD, options include augmentation with antipsychotic medications, deep brain stimulation, or intensive residential treatment programs. Novel approaches like transcranial magnetic stimulation show promise for future treatment development. Recovery and management. Recovery from OCD is possible, though it often involves ongoing management rather than complete cure. With appropriate treatment, most people experience significant symptom reduction and improved quality of life. However, recovery requires courage, as facing fears without performing compulsions is initially extremely distressing. Self-management strategies play a crucial role alongside professional treatment. These include mindfulness practices that help create distance from intrusive thoughts, stress management techniques that reduce overall anxiety, and healthy lifestyle habits that support mental well-being. Support groups connect people with similar experiences, reducing isolation and providing practical coping strategies. Breaking the stigma. Unfortunately, significant stigma surrounds OCD, compounded by trivializing portrayals in media that equate it with perfectionism or cleanliness. Phrases like, "I'm so OCD about my desk," minimize the devastating reality of the condition. This misunderstanding often delays treatment seeking, with many suffering for years before obtaining proper diagnosis. Education and awareness are powerful tools in combating stigma. OCD is not a character flaw or a sign of weakness, but a medical condition requiring proper treatment. By sharing accurate information and authentic stories of those affected, we can create a more compassionate understanding of this challenging disorder. Conclusion. Obsessive-compulsive disorder represents one of the most challenging mental health conditions, yet also one of the most treatable with proper intervention. If you or someone you know is experiencing symptoms of OCD, reaching out for professional help is crucial. With advances in treatment approaches and growing awareness, there is more hope than ever for those affected by OCD to reclaim their lives from this debilitating condition.